When most people think about safe sex, the first thing that comes to mind is often preventing an unintended pregnancy. While pregnancy prevention is certainly important, it's only one part of the story. Safe sex matters for many other reasons, one of the most critical being the protection from sexually transmitted infections, or STIs. Let's take a closer look at why practicing safe sex is so essential, not just for birth control, but for your overall health and the well-being of your partners. Sexually transmitted infections are infections that are passed from one person to another through sexual contact. This can include vaginal, anal, or oral sex. Some of the most common STIs are chlamydia, gonorrhea, syphilis, human papillomavirus, HPV, herpes simplex virus, hepatitis B and C, and HIV. While some of these infections can be easily treated and cured, others can have lifelong effects, and some can even be life-threatening. One of the most important things to understand about STIs is that many of them can be present in someone's body without any obvious symptoms. A person may feel perfectly healthy and still carry an infection that can be passed on to someone else. This silent transmission is a major reason why STIs are so common and why safe sex is so important for everyone, regardless of how healthy they or their partners might seem. Let's talk about the consequences of STIs. Some STIs, like chlamydia and gonorrhea, can cause discomfort and pain, but if left untreated, they can also lead to serious complications. For example, untreated chlamydia or gonorrhea can cause pelvic inflammatory disease in women, which can lead to chronic pain and even infertility. In men, these infections can cause painful inflammation and sometimes infertility as well. Other STIs, like syphilis, can progress in stages, causing more severe health problems over time, including damage to the heart, brain, and other organs if not treated early. HPV, which is extremely common, can cause genital warts and, more seriously, is responsible for the vast majority of cervical cancer cases, as well as cancers of the throat, anus, and penis. Herpes isn't life-threatening, but it's a lifelong infection that can cause painful sores and emotional distress, as well as increased risk of transmitting or acquiring HIV. Perhaps the most well-known STI is HIV, the virus that causes AIDS. While treatment has advanced dramatically, and people with HIV can now live long, healthy lives, there is still no cure. HIV weakens the immune system, making it harder to fight off infections and certain cancers. Importantly, people who are unaware of their HIV status are more likely to transmit the virus to others. Given these risks, it's clear that safe sex is about much more than just avoiding pregnancy. It's about protecting your health and the health of your partners. Using condoms or dental dams correctly and consistently is one of the most effective ways to reduce the risk of transmitting or acquiring most STIs. Condoms act as a barrier, preventing the exchange of bodily fluids that can carry infectious agents. Dental dams, which are thin sheets of latex or polyurethane, provide similar protection during oral sex. These protective measures are inexpensive, widely available, and easy to use, but safe sex goes beyond just barriers. Open and honest communication with your partners about sexual health, STI testing, and risk factors is crucial. Getting tested regularly, especially if you have new or multiple partners, helps ensure that infections are caught early and treated promptly. Vaccinations can also play a role. There are vaccines available for HPV and hepatitis B, both of which can prevent serious long-term health problems. Some people might feel embarrassed or awkward talking about STIs or using protection, but the reality is that prioritizing your sexual health is a responsible and caring choice. It shows respect for yourself and for your partners. Remember, anyone who is sexually active can be at risk, regardless of age, sexual orientation, or relationship status. It's also important to recognize that some people face barriers to accessing sexual health resources or education. Stigma, cultural taboos, and lack of information can prevent people from learning how to protect themselves. That's why talking openly about these issues and supporting comprehensive sex education is so important. When people understand the risks and know how to protect themselves, everyone benefits. Another common misconception is that only people who have many partners need to be concerned about STIs. In reality, even people in long-term monogamous relationships can be at risk, especially if they or their partners have had previous sexual relationships. That's why many experts recommend that couples get tested together before choosing to stop using protection. For those who are sexually active, there are a few key practices to keep in mind. Always use a new condom or dental dam for each act of vaginal, anal, or oral sex. Be sure to check the expiration date and the integrity of the barrier before use. Don't use oil-based lubricants with latex condoms, as this can cause them to break. Get tested regularly and encourage your partners to do the same. If you or your partner are diagnosed with an STI, follow your healthcare provider's instructions for treatment and abstain from sexual activity until the infection has cleared. Ultimately, safe sex is about empowerment. It's about making informed choices, taking control of your health, and building trust in your relationships. By practicing safe sex, you not only protect yourself from unintended pregnancy, but you also guard against infections that can have lasting impacts on your life. Remember, the decisions you make about your sexual health today can affect your well-being for years to come. By choosing safe sex, you are taking a positive step towards a healthier, happier future for yourself and for those you care about. Safe sex matters, and it's never too late to start making it a priority.